Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers. In last week's podcast, I shared how your health insurance is a key player in your health strategies as you age in place. Today, it's my pleasure to introduce you to Mary Jane Harris, my colleague and my friend, who is going to be joining us today to share more important insurance information that you can use this fall during open enrollment. She is also going to help us to get a bigger picture and a better idea on how to access the best insurance product for you and your current health status, your budget, and to help you in your aging in place strategy. Thank you for joining me today, Mary Jane.
Oh, Linda, it's a pleasure to be here. I could talk about Medicare all day long, but most people are not that interested.
Well, they're going to be interested today, and I want to encourage you all to listen. We are in a different taping environment, so just disregard if you hear any echo because the content is going to be very valuable and very helpful to you. Mary Jane, can you give us, our listeners, a high-level idea of your educational background and your professional background?
Sure. I have a bachelor's in social work. I have a master's in counseling and psychology, and I'm a licensed nursing home administrator. I've worked with older adults my entire career, first in their homes and bringing services to them there, and then as an executive director in independent living, assisted living, and memory care communities.
Wonderful. It's fun for me to hear about your background again. Mary Jane and I met when she was an executive director of an independent living community. And the company that I worked for offered a supportive care program within their community. The residents who lived there, who were beginning to struggle with their aging in place abilities, needed one-on-one care services so that they could remain in place and in her community, which they loved dearly. I discussed supportive care services in a previous podcast, but just so that our listeners know what supportive living looks like within an independent living community, let's just do a quick review. Remember, independent living communities are not licensed to provide care. Supportive living is a support system. It provides care to clients who are needing more assistance with dressing, grooming, toileting, medication reminders, and escorts to meals. These are private pay services and are in addition to the room rent. The particular community where Mary Jane and I met and worked together had a social worker on site, which was very helpful to the residents because that social worker could help the residents access resources that they might need beyond the community to be successful, or they might need services within the community that could help them be successful. When Mary Jane and I were working at that particular community, independent living communities were popular, but now we tend to see more assisted living communities that are licensed to provide care. Mary Jane, you are an executive director, and that is where I continue to work with you and be with you. But you started your own company a couple of years ago, Independent Medicare Advisors, and I was wondering if you could just share a little bit of information about how you got there.
A couple of reasons. The first and primary one was I would see residents who didn't understand the Medicare choices that they had made. For example, they would perhaps break a hip, they would have to go to the hospital, and 10 years ago, 5 years ago even, people went to rehab after that and received intensive rehab services so that they could get back on their feet. More recently, however, people are sent back home, whether they live in independent living, assisted living, or in their own home. And then they have therapy services that come to them. So if someone has a Medicare Advantage plan, they will have to pay a copay for that service. Typically it ranges between $30 and $40 per visit. So if someone has speech therapy, occupational therapy, and physical therapy, and they have one of those a week, that could be from $90 to $120 a week, and they didn't understand that they had to pay that out of pocket. Now, Medicare Advantage plans do have what they call a maximum out-of-pocket amount, but those are typically in the thousands. So anywhere from, I've seen it as low as $2,500, but as high as $6,700. So they would have to pay out of pocket until they reach that limit annually. They didn't realize that when they had signed up for the plan. So it became my quest to help people make good decisions at the very beginning and know how that was going to affect them later. And then as I grew a little bit older, family and friends started going on Medicare. My sister called me almost in a panic, and she said, I have this mountain of mail. I'm getting more phone calls this month than I've had in the previous year, and I don't know what to do. You know stuff about Medicare, don't you? I said, well, yes, I do. And it just went from there. So it sprouted from both of those places. And my desire is just simply that people understand their choices. I have clients that choose original Medicare with a supplement and a Part D plan, and I have clients that choose Medicare Advantage plans. It is up to them. My job is to explain the differences and the nuances.
And then let them make the choice.
They make the choice.
So when Mary Jane and I met, probably a year and a half ago, when she was talking to me about her new company, I said, well, how come you didn't become a broker? How come you wanted to remain independent and not associate or be able to sell a lot of insurance products? What did you tell me that day?
Well, Linda, if I recall correctly, I think I said I'm unbiased and I work for my clients. I don't receive a commission. Some of the commissions for Medicare Advantage plans are $600. So if you sign up for a Medicare Advantage plan, that agent or the broker agency gets $600. I don't get any of those commissions, and I don't want to. I don't represent any plan. I'm an unbiased source that works for my clients solely.
And that really resonates with the ethics of a social worker. And remember, you heard that Mary Jane is a social worker by education.
Well, I just can't thank you enough for being with us here today. Let's get started. I had a couple of questions that I wanted you to go over for my listeners because I'm not the expert on Medicare services, but I'm so glad that I was pushed by our clients as well to say, this is what this is used for and this is what you can expect. But again, I've got an expert in the room, so I'm going to defer to her to share with us what is open enrollment? What does that mean to my listeners?
Open enrollment is a period in the fall every year from October 15th through December 7th. And during that time, there are specific things that you can do to change your Medicare path or plan. The first thing is you can join, drop, or switch to another Medicare Advantage plan, or add or drop drug coverage. Number 2, you can switch from original Medicare to a Medicare Advantage plan. And number 3, you can join a Medicare drug plan if you're in original Medicare. Or you can switch from one Medicare drug plan to another if you're in original Medicare with a supplement and a Part D drug plan.
Perfect. So this period's important.
This period is very important, and for people who are familiar with Medicare, it's important to check your plan. If you have a Medicare Advantage plan, you want to check your Medicare Advantage plan. And what I mean is the plan still going to cover all of your doctors and all of your medications at the same level it did before? If you are on a Medicare Advantage plan, watch your mail. And you'll be getting all kinds of mail because there's commission for renewals and changes too. So you're going to be getting mail, seeing those advertisements this time of year. Don't ever call those places, by the way. Those are call centers, and they're not there to help you. And so you will get what they call an annual notice of change, or an ANOC. Watch your mail for that. Don't pitch it, because that lets you know what changes are going to take place in 2024 with your Medicare Advantage plan. Their formularies change, their doctors can change throughout the year, so you really want to look for that. But this is an area where people have really saved money. And our natural tendency is to keep with the same plan that we've had because it's working. You feel like things are going fine, I don't even need to look. Well, there are a couple of instances where I've gone over someone's medications and they save between $200 and $700 a year just by reviewing and changing their Part D plan. So it's worth it for everyone. I encourage you to go to healthcare.gov, take a look at that. You can put in your medications and it will bring up the plans and show the cost that it would be for you.
Perfect. Yes, don't miss the special, the open enrollment period. But I have heard people like you tell me that there are also special enrollment periods. In my practice, visiting with clients, I will have adult children who say, we didn't know what this insurance was all about, and now it really doesn't meet our parents' needs. We have been getting a lot of feedback from other professionals in healthcare saying it might be time for you to relook at your parents' insurance. So what's that called, Mary Jane? Not open enrollment, but...
That's called a special enrollment period, and there are certain qualifying factors, and one of them being that, let's say, for example, a Medicare Advantage plan covered your doctor, but during the mid-year, your doctor is no longer a part of that network. Then you can change, okay? The largest category that I get calls about are people who say worked past the age of 65. So they're 67 or 70, and by golly, there's a lot of people that do. And so they call, and what they're in now is they have a special enrollment period, because if their initial is when you turn 65. But as long as you have creditable health insurance coverage, typically through your employer, then you can stay on that plan until you retire. And that is a qualifying event for this special enrollment period. The other large category of people that might apply to are older adults who are on Medicare, and let's say they live in Rhode Island, but they're going to move near their daughter now in Illinois. They can change their plan at that time. That's a special enrollment period when you move out of your zip code.
Perfect. And those are things you need to know, and they happen quickly sometimes, and that's where we've called Mary Jane and saying, hey, look, this is who we have, and can you help them? So thanks for doing that for us. Are there questions that you should ask, or let me phrase it this way. What's the question you are asked most frequently from people that call you? And Mary Jane has clients all over the U.S.
Yes. The major question that people have, and it's a good question, is what is the real difference between Medicare Advantage and original Medicare with a supplement and a Part D plan? And it's very confusing, and so we take our time and we go through both of those, and many times they'll call back and say, I think I've got this, but I'm not sure. And they'll double check and make sure that they're processing that information correctly. If you don't do this all the time, it's not automatic, and it is confusing. So when people enroll in Medicare, your first thing is that you have the option of two paths. You can choose original Medicare with a supplement and a Part D plan, or you can choose a Medicare Advantage plan, and those plans typically include your Part D plan plus some supplemental services that some folks find very desirable or advantageous to them. That's your hearing, dental, vision, gym memberships, and things like that. But that's the biggest distinction that we work on in the very beginning that I do with a new client, is what is that difference? And then mountains of questions come from that discussion. And it's at that time that people are trying to figure out what's going to be best for me.
And each client is different.
Each client is different.
There is no one size fits all.
No, so don't go to dinner with your friends and because they like United Healthcare, Walgreens plan, think that it's good for you. Everyone is different. It's more common if I work with a couple that they end up on different plans if they choose Medicare Advantage, because they have different medications, they have different diagnosis, different doctors. One prefers this hospital, one prefers this hospital. So it doesn't happen often that they end up on the same plan.
And what I noticed is when you were talking about, the caps on the out-of-pocket costs, that came in after those Medicare Advantage plans came into being, and we had clients, Mary Jane had residents, we had clients who were shaking papers at us saying, my out-of-pocket costs are exorbitant.
Yes.
And then the caps came in. So caps are wonderful on the out-of-pocket costs, but all I can tell you from my limited perspective is that it's all numbers.
Yes.
It's just they're playing with dollars and cents and numbers, and so like Mary Jane said, choose your path, but sometimes you just remember that it's all just numbers, it's all dollars and cents, and just to choose the right plan that seems to make the most sense for you and your comfort level.
Correct.
And that's really the biggest part of it. And once you figure out that you have the right plan, you can relax.
Yes.
You can feel good about that decision.
Yes.
But nobody just throws a dart at the dartboard. You have to focus and concentrate and hit the right spot.
You really do, because this is your insurance, your health insurance for the rest of your life.
Yes.
For the rest of your life. It's somewhere in this category of Medicare coverage. So you need to be sure. And I think one of the caveats that I would like to share, because I think people don't understand this all the time, and I don't, why should they? because I don't know that they're even told about this. But if you turn 65 and you choose a Medicare Advantage plan, you only have your 6 months from when your Part B is effective to change to original Medicare with a supplement without medical underwriting for that supplement. Now you have to well, you don't have to. We can do whatever we want. But it's advantageous financially to have a supplement because really Medicare only covers, A and B only cover 80% of your costs.
Right.
So you want that other 20% covered. So you need a supplement. During that 6 month period, there's no medical underwriting. And sometimes people will go with Medicare Advantage because it's cheaper. Supplements can be expensive. In different states, it can be even more expensive. It just depends on, and supplements are run by the state. They're regulated by the state. So some states operate just a little bit differently, although all the letter plans remain the same except for 2 states, Minnesota and one other. So it's just really important to understand if you have to go through medical underwriting, they're going to ask you if you've had cancer. Have you had a recent surgery? When's the last time you were hospitalized? Do you have diabetes? Do you have a heart condition? What is it? And you have to disclose everything because they have access to your medical records. So if you have ALS, if you have dementia, you're not going to pass underwriting, and you've missed that window. So you will have to stay with Medicare Advantage. You can switch your plans within that, but you will have to stay with Medicare Advantage.
And I imagine, Mary Jane, that my listeners are now all of a sudden looking at their partners or their loved ones or wondering, oh my gosh, what do I do now? I think I need to talk to Mary Jane and learn more so that I make sure that I'm on the right track. So how can people find you? Are you on do you have a website? What's the best way to reach you?
I have a website. It's independentmedicareadvisors.com. My phone number is 636-485-2615, or you can email me at Mary Jane at independentmedicareadvisors.com.
Thank you so much for being with us today, Mary Jane. Mary Jane she has her own company, but she is very much still an executive director, and she runs buildings with over 100 residents.
Mm-hmm.
And when you have 100 residents, you have just as many support systems and loved ones that you need to interface with. And so I view that role as very much a caretaker, a caregiver role. You're giving out all day long, not only to your staff, to vendors like me who would come in and visit with you, but also to families and residents who are in a new place or a new space or a new healthcare situation. I always give a caregiver tip at the end of every podcast, and so I wanted to ask Mary Jane how she nurtures herself. So, Mary Jane, given all that, how do you nurture yourself?
Let's see. I think one of the things that brings me peace is going for a walk in nature outside, and fortunately in our area we have a lot of those, and just not thinking about anything, being present in that moment of walking among the trees, what kind are they, and not thinking about work or about other people, or frankly about my family. And I also like to read, and so those are 2 things that I think pull me out of that loop of thinking and worrying and being concerned and clears my head.
Are you intentional about that?
I am very intentional about that. Yes.
Thank you so much for being with us today. Your information is valuable. If you haven't picked up on it, Mary Jane is very passionate about what she does, and I know that you will love visiting with her if you're ready to make some changes or you just have some questions. So thanks again, and join me again on Aging in Place, Strategies and Answers, where you'll learn more.
Thank you for joining me today. Please subscribe and share episodes with friends and family who are currently in crisis or are ready to start developing their own roadmap for aging in place. Remember that this podcast is guidance and not advice. If you have more specific questions related to your particular situation, please reach out to me at linda.agingstrategies@gmail.com. Join me again next week and we'll learn more.